Yeah.
We've been in your shoes not too long ago. So if you guys ever need any resources, even outside of pharma and industry, we're definitely here for you.
Absolutely.
Give the encouragement. Love to see it.
Of course. So first, just want to say thank you all so much. My name is Tatiana Hines. I am one out of the 4 influencers of the Pharma Collective. And thank you so much for being here. We've hit some milestones since we've last had our last webinar, including having now season 2, having our highest engagement that we've ever had so far with you guys being here today. We've had new positions, through leadership, we've had new opportunities and so many great things that we have been able to learn, including on our appies. So just wanted to say thank you all for being with us. We officially also hit our 1 year. So the Pharma Collective is now on to year 2 and season 2. So this is episode 1. We really look forward to continuing to share our journeys as well as helping you all navigate through yours. So today is what I wish I knew, navigating postgraduate programs. And the reason why we wanted to be very selective in our verbiage with saying postgraduate is because we will be highlighting 2 different avenues that PharmD students that we all look up to have done. And that is including fellowship and the leadership developmental program as well. So first, we have some new faces, some old faces. So I think it would be good for the Pharma Collective to introduce ourselves. So for me, my name is Tatiana Hines. I am a P4 at UNC Chapel Hill. I first came from New Jersey. That's my hometown. And I'm interested in the regulatory affairs space.
I can go next. Hi, everyone. My name is Melka Tawalda. I am from Charlotte, North Carolina. I'm Eritrean, so if they're East Africans, woohoo. I'm currently a 4th year PharmD MBA student at High Point University, and I plan to go into the commercial space. I'm still open on which functional area.
I'll go ahead and jump in next. Thank you, ladies. So my name is Matthew O'Toole. I am a 4th year pharmacy student from Texas Southern University, born and raised out here in Houston, Texas, the greatest city in the world. Yes. And I'm interested in going into the medical affairs space. Thank y'all for being here.
All right, last but not least, my name is Joseph Kalu. I'm a P4 from Howard University. Not born in Jersey, born in the United Kingdom, but raised in Jersey. Interested in going to the clinical dev space and looking forward to it. So I appreciate everybody that's coming out tonight.
Awesome. Thanks, y'all. So again, just wanted to say thank you, and then we will progress the slides so we can keep it pushing.
All right. So as you can see, this is our agenda for today. First off, we're going to start by seeing how the audience is. Next, we already kind of did it already, but we did introduce the TBC, which is the Pharma Collective. And finally, but not least, what you're here for, we're going to go into what I wish I knew panel.
So season 2 is here, like Tati said. Something that you're going to hear constantly is that we really rope on this engagement part of our collective. We really want you guys to be active with us, engage with us, turn on your cameras, speak with us. And what better way to start that by asking you guys a question. What industry-related activity have you guys done this summer? I can go ahead and get started. Something I did really cool with Tati actually was the SMDP, which stands for the Scientist Mentoring Diversity Program for Biotechnology. We were able to go to San Diego, California and meet with like literally thousands of industry professionals and just connect. And it was a very life-changing opportunity, I can both say, for both of us. So it was a great opportunity. Anyone else want to join in?
Yeah, I just want to piggyback off of SNDP. It was the most amazing experience. It was my first time going to California. And I think it was a close tie between what I enjoyed the most. Like the SMDP experience was great, but I also met or was really close to one of my idols, Venus Williams, and I tried In-N-Out. So if there are any In-N-Out lovers, In-N-Out is better than Shake Shack, 100%.
In-N-Out is not it. I'm sorry.
In-N-Out is it. This is a hill
It is
I on.
You
Did
did
anyone else want to
anything
tell us?
industry related except for Appies?
Sissy did a PV Appy at United Therapeutics. Oh, that's awesome.
That's nice.
Libby, networking with fellows and other industry professionals. In-N-Out is the rebranded McDonald's.
Big fact. Whataburger is way better. I'm right
Listen.
there with you right now. In-N-Out is the rebranded McDonald's. I love that.
Kelsey knows exactly what I'm talking about, okay? In-N-Out is where it's at.
Medical affairs Appy at Radius. That's pretty cool.
That's dope.
I love the pharma related appies, guys.
Yeah, I love those. Out in the South, we don't get too many opportunities, so I love to see anybody who gets like pharma appies like that. So that's really dope to me. There we go.
Hey, we got a regular affairs intern with Regen Bio. Tough.
Love that.
One thing that we also want to highlight, what we do on social media is a lot of the time you will see some of our accolades, but we really, again, like you are a part of the Pharma Collective. So with that, if you ever want to send us or tag us in any of your own posts about day in your lives or any things that you have completed, like internships or Appy experiences, we would love to highlight you. And we'll share our Instagram information at the end. And if you have any experiences that you'd like to talk about or be highlighted or just share so other people can also know, make sure to send us those messages.
Absolutely.
I think the perfect way to end off, we just started P1, still working on it. I think you're already at a great start by being here, to be honest. So excited for you and for your journey. I know you're going to go great places already. So let's go on to the next slide.
Okay, so I was trying to respond to Courtney and Kayla. I do love y'all experiences. That's pretty cool as well. Just didn't want to make sure that was said. But before we kind of open up the floor for our amazing panelists, we just kind of wanted to take a moment to tell you who we are, but really what we represent for those, again, who may be kind of new to what we do. So in short, we're a group made up of 4 minority students that are eager for careers in the pharmaceutical industry, but even more for others like you all to have successful careers in pharma as well. So our mission is to simply capture the influence that the pharmaceutical industry has on consumers, economics, as well as health behaviors from the perspective of student pharmacists. Our vision is to diminish the barriers between pharmacy students and pharma by educating and providing more student opportunities, as well as bringing a continued fresh perspective to all things pharma. So some of our main values and things that we encourage, again, kind of like Milka alluded to earlier, is engagement. So whether that be on our live events or like our live events like now into the chat, or you guys coming off of mute, we love and encourage you guys to be engaged with us, or whether that be through our social media posts. We encourage transparency. So we plan to be very authentic and share our experiences just how we are and just how they happen. So we won't kind of hide, or we won't kind of boost or make things seem more real than they were. And last is our cultural awareness, because that's just important in any facet of life. So that's just a little bit who we represent. So now kind of let's get into who we are one last time for y'all.
Yeah, so we are the founders, and we have so many great plans and so many things that are set in the works for you all, and also for pharmacy students and postgraduate students that are after us. Again, we are 4 students from 4 different parts of the country. We all have different experiences at our school, whether we are newer programs, attending HBCUs, PWIs, geographically restricted locations, and we all have different perspectives, and that we are also traditional and non-traditional pharmacy students as well, meaning some of us went straight into pharmacy school, others took years off to join the workforce or to get advanced degrees. So what we want to do is to set an opportunity and set a platform that is not just us, but it's you all as well. So we hope that with at least one of us, you'll find a little bit of peace that is relatable to you, so that you can learn and excel and propel your own career within the pharma industry.
All right, so without further ado, let's get started with our panel. Once again, our panel is focusing on navigating postgraduate programs. So next slide, please.
All right, so the 4 people that you're actually here for, let's start with Dr. Akene Aronu. He is a U.S. Oncology Marketing Fellow at Merck, affiliated with the Rutgers Pharmaceutical Industry Fellowship. Can you just tell us a little bit about yourself, Dr. Aronu? Ranu, sorry if I know I'm.
No,
I'm
you good.
sorry.
You good. It's Aranu. But yeah, thank you very much for this. I'm very happy to be here to kind of talk to you guys about this. So I went to school in Mercer University in Atlanta. I'm originally from the best city in the world, Los Angeles. Shout out to Tatiana for that In and Out, because In and Out is it. You feel me? So yeah, and what else did you guys need? School and what
Maybe a
else?
fun fact about you.
Oh yeah, fun fact about me, I'm a soccer guy. Favorite team is Chelsea, and I guess I just recently moved to Philly. So still trying to navigate what the city's about. So yeah.
Respect it.
Thank
That's your
you. Thank
birthplace,
you.
man.
Next up, we have Dr. Nahum Petros, who is a marketing manager with the Marketing Leadership Development Program with Johnson & Johnson MedTech.
Hey guys, like she said, Nahum Petros, born and raised in Northern Virginia. I'm not going to claim that as the best city, but yeah, went to pharmacy school, did my dual degree MBA, and then about a year ago, I got to start my program here at Johnson & Johnson. I'm a part of the Marketing Leadership Development Program. I'll be talking a little bit about what that means today, but it's a pleasure to be here, and thank you guys for having me.
Next up, we have Dr. Shireen Sharma. She is a U.S. Regulatory Affairs Fellow at Beijing.
Hi everyone, my name is Shireen. I went to school at Temple University School of Pharmacy, which is based in Philly, which is also the best city in the world. For I just moved there. And I guess the fun fact about myself is I used to be a makeup artist for Chanel. And then, yeah, I can talk a little bit about Beijing, which is the independent one-year fellowship program.
Wow, thank you for that. And last but not least, we have Dr. Jordan Simpson, who is a worldwide and U.S. oncology medical communications field medical fellow at Bristol Myers Squibb, which is affiliated with the Rutgers Pharmaceutical Industry Fellowship. That was a very long title. I don't know if you say that every single time you go anywhere, but it was nice to have you.
Thank you so much. Thank you for having me. So yeah, it's a pretty long title. I just say I do a lot, but okay. Born in the Bronx by way of Manchester, Jamaica. Fun fact about me, I'm a poet. So spoken word poetry is my thing. And yeah, so just a little bit about Bristol Myers Squibb and the position title. So that's the title that Rutgers has for the fellowship, but the position as defined by Bristol Myers Squibb is worldwide and US, worldwide scientific content and market capabilities, and then US oncology field medical. So there you go.
Thank you for the clarification. And
No
thank
problem.
you everyone for being a part of us today. We're so excited to get things rolling. So let's go on ahead and to our next slide.
Perfect. So the first question, starting it off, is we'll go ahead and actually start with Nahum, since you kind of have more experiences in this, and then we'll kind of let our those with our fellows kind of speak more after. But the first question is, what's the difference between a fellowship and a leadership development program, as well as what does the application process look like for each?
Yeah, so this is a great question. So I think typically pharmacy students are very familiar with the process for fellowships. We hear about all the time. We're very familiar with the Rutgers program, MCPH, all these different universities. So the way I like to think about it, and just for anyone that's hearing about leadership programs for the first time, I heard about it for the first time as I was going through the application phase. So it's not a surprise. Every time I mention it to pharmacy students, they have not heard about these opportunities. Partially is because the majority of leadership development programs are specific for students with their MBA as well. So that's always usually a small subset of students that are pharmacy students. So that's probably one reason. There are leadership development programs that don't require that, but just wanted to point out that caveat early on. The easiest way I can kind of describe a leadership development program, it's a hybrid between a fellowship and a full-time job. So it's, to me, I like to say it's like a little bit of both because it has the benefits of both. So it's rotational. Both aspects are rotational with a fellowship as well as a leadership program. Both tend to be around 2 years, and you rotate and get different experiences with an added benefit that you are seen as a full-time employee directly of the company. And usually that does come with full-time pay versus like an educational stipend that you get when you're doing a fellowship. So that's just a brief glance at it. It varies from company to company. And sometimes the title changes. It might say MBA program or leadership development program, but that's the gist of it.
And what does the application process look like in your experience in the LDP program?
Ironically, it is much harder on the fellowship side. I think that's because pharmacy students are normally geared towards that trend. So you have literally thousands and hundreds for a specific job applying for the same fellowship versus these leadership development programs. It's kind of like an open job where, it's a smaller pool of candidates applying. So being that they have so many pharmacy students applying to fellowships, they can be so much more demanding on the application process. They can have multiple stages, require the cover letter, and everything else that fellowships require. Typically with the leadership development program, it's like a job. It's like a regular open job. You do 1 to 2 levels. There's no letters of recommendation that are really needed. It's kind of just like, do you meet the requirements? You meet with the team to make sure you're a fit, and then you meet with leadership to make sure you're a fit. So I saw that it was a little bit easier on the leadership development side in terms of interviewing, but the requirements are much higher.
Awesome, thank you.
So maybe let's hear about how the fellowship process is like, a little bit more in detail for those who have gone through that process.
Okay, so I think I've had a little bit of experience like applying to like a lot of different programs, both standalone programs with pharmaceutical companies by themselves, advertising for fellowship positions, as well as kind of like the varying paradigms or methodologies that different programs kind of like operate off of. So you have Rutgers, right, who has formalized their process, given their longstanding as a pharmaceutical industry fellowship program, right, where you have defined sessions, you do an informational session, screening calls, screening interviews, first round, second round, third round, and then pre-COVID, they did like a reception where at mid-year and stuff like that, and final interviews and stuff like that, right? Now within the COVID environment, that's a little bit different, taking into account the virtual environment. So they do mitigate those different, I'd say those different processes respectively, but it still kind of like goes along that same process of having an informational session, network sessions for the respective programs, going through the rounds of interviews, then followed by offers. Whereas individual pharmaceutical companies, they would probably have a process that is somewhat similar, but it's just coming straight from that entity. It's not tied to an academic institution, right? So sometimes weighing those benefits is a decision factor, like is a determining factor that you may weigh into your decision of applying or not.
That's a great.
Oh, sorry, I can kind of echo what Jordan just said. So my program is independent. It's not affiliated with a university. So that, like you said, the application process is similar. No matter where you apply, you're probably going to need similar materials like a CV, letter of intent, letters of recommendation. That for the most part will be the same no matter where you apply. I think the difference is just like independent programs, you're not applying through Rutgers, you're applying directly to the company. So they're kind of handling everything versus, so there's no like university component essentially.
Also, just to piggyback on Jordan and Sharma, they pretty much covered everything. But in terms of the reception, we did have it virtually last year. So if you were invited to it, you were kind of like in a virtual room and you were in a bubble, kind of bouncing around, going to the different places and talking to people. So that was pretty cool. Another thing too that I wanted to talk about was, oh man, what was it? So each company has like different interviews. So some companies have like 2 interviews or 3 or 4. I know like I applied to Sanofi at MCPHS, and I pretty much had like 3 main interviews, but then I had like a project they wanted me to do, so I had to turn that in also. So I had 3 interviews for that, and then some companies have like 4 interviews, or you just have 2. I think Novo Nordisk was more like 2. It was just like 1 round, and then you kind of have like a final round interview. So it just depends on the company also.
To follow up on that, so Rutgers, so like what is the benefit of like getting a fellowship as a standalone with a company versus what's the benefit of having one with an academic institution as part of that program or fellowship experience, is really kind of what they offer, right? And that is like varying based on like research, whatever the company kind of like figures out what they want to offer. And the academic institution, I believe that they have certain standards or accreditation processes that they need to ensure. Like they need to have some type of scholarly activity component associated with their programs. I know Rutgers, they offer tuition remission if you wanted to take certain classes towards getting your MBA. That opportunity is available. They have a teaching and learning certificate program, something that I'm interested in, and they do accommodate for virtual students as well, to be able to teach precept and API student, and to develop poster presentations or other CE developments with faculty of Rutgers University. So that's another opportunity. So it's really just weighing your options of what type of experience would you like to have. I'm not necessarily sure of the wealth of information or the wealth of opportunities that are with individual companies sponsoring the fellowship program as opposed to academic institutions. So maybe Dr. Sharma can shed some light on that.
Yeah, I can kind of speak to that. So like Jordan said, there's no university component. So your fellowship is just based on, like, for example, mine's rotational. So every few months I'm changing, like within regulatory, like where I'm going. But yeah, there's no teaching component. That was fine for me. I wasn't too keen on teaching. So that's not something I was looking for in a program. But if you are, like, that would be something you wouldn't possibly get. But my program's also 1 year. So I felt like if I had a teaching component, it would take away from maybe like the things I would be doing at the company. So for me, like, I wasn't too mad about not having a teaching component because I wanted to be able to do more things at the company that directly would translate, I guess, into what I would be doing in the future. But if that's something like getting your MBA and like tuition remission is important to you, then maybe that's like consideration. I think everyone has to kind of make that decision for themselves because there's so many programs out there, independent, affiliated. So I think, and each program is a little bit different. So I think if teaching is important to you and that's something like I have like, I think every company is different, but like at my company, we take interns. So I can kind of get that from there. And I feel like networking, like this is networking, I feel like that kind of comes from anything. So I think it just depends on what you're specifically looking for in a program.
Awesome. Thank you so much. All great and amazing perspectives, which is why we were very careful in selecting the 4 of you because we thought you would all be able to bring very unique experiences and different postgraduate opportunities. So we could go on to question 2, and it is, what are some key differentiating factors that you considered when picking between programs? So I know this is kind of something that we touched base on, whether it was university affiliated or independent, but were there any other differentiating factors that you had to consider when you were going between programs or different companies? And we can start with Dr. Aranu.
I'll be honest. At first, I didn't have any factors because I just wanted to land a fellowship. To be honest with you, but then, as I kind of went through, like, the interview process, you kind of learn a lot. So when they tell you, like, when you're interviewing, you're also interviewing them. I was kind of able to understand how the team works and just kind of seeing like what things I would be working on, during the interview because I asked those questions, and I think that's one thing that kind of like that's one thing that made me differentiate the programs I wanted to go into. For example, Merck is a great program because they really want you to learn. My preceptor is putting me in certain positions for me to get as much experience as I can, not just from a marketing side or like not just from an HCP side, but also from a consumer side, so that I can just have the whole scope of marketing and just become a better marketer in the future and just learn a lot. So that was like my main differentiating factor. I really didn't care where I went because, like I said earlier, I just wanted to get a fellowship. But yeah, the most important thing was just talking to the people and just seeing how they were as individuals and seeing if we would be a good fit. So that was the main thing that I looked at when picking a program.
I can just echo that. what your role, like a lot of these positions like reg, like med affairs, what you're doing is probably going to be very similar no matter where you go. The people in the company is like the most important thing, especially the people, because like I said, what you're going to be doing across a lot of these companies is the same. Like for regulatory, like how you file a submission isn't going to change whether you're doing it at a big or small company. So what's important is like the people, because those are the people that are going to be pushing you to kind of, they're going to be the ones bringing you all these opportunities. I can say for myself, like my fellowship director, like she's amazing. Like I've already had the opportunity to present at like big conferences and be able to work on projects that I wouldn't even think I would be able to as like a fellow. So I think think about like the people, and especially for a lot of these programs, 1-2 years, it's a long time. So you're going to be working with these people for 1, 2, maybe 2 years. So that's really important to take into consideration. And for me, I also wanted something that was rotational, because we don't learn a lot about industry, pharmacy, like industry and like pharmacy school. So unless you have, even if you had an internship, it's probably in something specific, right? So you might not know what all these, different things within regulatory or different things within med affairs or commercial like entail. So for me, like having a rotational component was important. So I got that I would be able to get experience in all those and be more well-rounded applying for a position afterwards.
I think one thing that students don't necessarily consider, that looking back, I probably should have considered more, because a lot of us are in that stage where we're excited about it. We're trying to land that fellowship, that role, that job. Something I didn't think about that I always think about now is there a therapeutic area that you like, that you want to work in? So as a pharmacist, you come out and you're expert on all drugs. You get into the industry, and depending on what company you go to, there's their major blockbuster drug. They have a couple of them, but you're going to be expert on that specifically. So, as you're going through pharmacy school, there's going to be some classes you like more than others. There's going to be some drugs you just find interest more than others. And so now I go back and think like, wow, okay, now I have a specific type of therapeutic area I want to work on. And so that's something I didn't consider then that I definitely would have going back. Something I was considering was just networking. So I did, when I was looking at fellowships, for example, I definitely looked at Rutgers and was like, wow, this is a really good network of PharmDs. These people are all going to be leaders in the future. And so like to have a network of people that have the same educational background as you that you can grow close with and then go into different companies, I think that's huge. So I definitely looked at the network of people I would have built. Location, not so much, because the majority of companies are all in the same place. But yeah, network, and then even therapeutic area if you're thinking like that.
To echo what everybody said, you can only analyze, or you can only inference the value of a tree by the quality of its fruit, right? So one thing that was big for me was, where are the people who completed this fellowship? Like following the breadcrumbs of what these people that have been in my shoes have successfully applied for the position. Where are they now? What are they doing? So with that being said, I spoke to alumni that were 2, 3, 4 years removed from the programs that I was applying to, and said, how has the fellowship position like aided you in your professional development journey? And I was fortunate enough to have someone that wasn't a Rutgers BMS fellow, but she was a FAMU BMS fellow. And to see the fruits of her labor and how she has been a prominent person that has been instrumental in my professional growth, that was something that I identified as, she always talks about BMS being so integral in her industry career. So there's something about BMS. And I kept on following that to make sure that that was something that stood out. And, I had that certainty of BMS is kind of like where I want to be. Outside of the qualitative things, right? The experience, the quality of the experience, there are definitely certain things that I took into consideration. Therapeutic area, like Dr. Petros said, was something very important, because oncology, immunology, neurology, or rare diseases were something that I was passionate about. And I always wanted to stay connected to, right, given my personal story. But within that geographical location, how did these respective companies and programs respond to COVID? What were their COVID guidelines at that point in time? Was hybrid a thing, right? Because I applied in the midst of the COVID pandemic, where a lot of things weren't as clearly defined. So trying to figure out what that looks like and how did the company adjust and what are their protocols? What does that look like? But finally, to add to the qualitative experience, right? My preceptors were like the quality of my preceptors were something that became a determining factor during the interviewing process, because I moved from the concept of who pours into me matters, right? You're at the infancy of your professional career, and at that point in time, it's almost like the infancy of life. There are certain things that will be encouraged that will stick with you throughout your lifetime. So at that point in time, I want to make sure at the very beginning, I'm developing great habits. I'm developing great concepts and I'm creating a paradigm that will feed me for the rest of my career. So I kind of grilled my preceptors during the interview process. I asked them how they respond to their mentees or their preceptees when they fail, right? Because that is integral as far as, can you build someone up and not just be okay with a perfect product coming through the door, right? Because I asked them what makes a progressing fellow, not a perfect fellow, because there's a difference where you can just look at something and be like, oh yeah, that's fine, rather than I can work with that, because that's the quality of the builder, so to speak.
That was great. I can definitely see your fun fact shining through, how you're a poet, because the fruit, the everything, you are amazing. So that was great. I will pass it over to, I think, Joe. Is this you, question 3?
Yep, this is me. So moving on to question 3. What is something that you wish you knew sooner in your postdoctorate program, and how did you cope with it?
I could take this. I wish I knew how many opportunities there are for PharmDs in the industry. I talked about it a little bit earlier, how we're always kind of pushed towards this funnel of either retail, residency, or fellowship is your only opportunity within the industry. I can't tell you how far from the truth that is. For example, so not only am I in a differentiated program because it's a leadership program, but I've transitioned from the pharmaceutical industry to I'm technically in the medical device industry. So the products I work on within Johnson & Johnson on the medical device side within orthopedics are joint replacement. So behind me, you see some knees, some femurs, some tibias back there. We make the metal components that sit on top of the tibia and between the femur. And so it's completely different from pharmacy, anything we're learning in classes. And, it's an open opportunity for people that are willing to transition, try something new and learn. And so there's all these opportunities. By doing the research now, so I saw like someone was in the chat as a P1, that's amazing. So by being this early in the game, you get to do the research, you get to see what's going to differentiate you as you want to go and apply for these things. You can look at these job postings now and you can be 2-3 years out and honing your craft and getting your resume ready. So I wish I knew how many different opportunities there were, and they're available to all you guys.
I can go next on that one. There are actually like 3 things that I kind of wish I knew sooner. I kind of knew them in the back of my mind, but it's kind of different when you experience them. So the first thing for me is just adaptability. Once I got my fellowship, I had a preceptor. However, like a month before I started my fellowship, my preceptor changed because he got promoted to like the vice president of oncology. So I had to pretty much get a new preceptor. My new preceptor was pretty awesome. So just being able to adapt with that. And also a month into my fellowship, I had to change teams. I was previously on the prostate team, and so our clinical trials failed for Keytruda in prostate cancer. And so because of that, we had to stop all our work streams, all our marketing work streams. And so my preceptor wanted me to pivot. So I had to pivot into the bladder team. And I actually just started on the bladder team this week. So I think adaptability was one of the biggest things. The second thing is there's no such thing as a stupid question. You know, sometimes I can kind of be like egotistical in the sense that like, oh, I should know this already, or well, this is easy. I don't need to ask any questions. But if your mind just has some type of like question mark, just ask it. Because I mean, that saves you a lot of work. Because once you mess up, you know, you kind of have to go back and try and figure out ways to kind of fix it. So yeah, the second thing was like, there's never a stupid question. Just ask all the questions. You're new. Don't put that pressure on yourself that you have to know everything. I know we all want to be perfect. Like Jordan said, you just want to progress. You know, you can't be the perfect person. Nobody's perfect in this life. If anybody tells you they're perfect, they're lying to you. So the last big thing was networking. Networking is really strong. It's kind of crazy because, you know, I've been networking with people, and because of that, I've met a lot of cool people in Philly. Because you know, I networked with somebody like, oh, do you know this guy? He lives in Philly, and you know, you guys can end up grabbing a drink, and you kind of learn more about them, and then you kind of learn what they do. For example, I was hanging out with one of the guys in finance, and you know, we're kind of talking about the IRA, which is the Inflation Reduction Act, and so things like that. So you kind of learn a lot, and then this kind of helps you out, you know, at the end of your fellowship in case you're coming for a position. And if you've spoken to all these different people or stakeholders in the company, you've networked properly, once it's time to look for that position, you can just, hey, I'm looking for this position, and they can just plug you in, put a good word for you, and you know, and you're set. So those three things, networking, there's no such thing as a stupid question, and just being able to adapt. Those are my main three things that I wish I knew sooner, even though I didn't know it, but it just didn't hit until I experienced it.
I definitely want to echo what you just said about networking. Like, it's pharmacy, especially pharmaceutical industry, is a very, very small world. Like, everyone knows each other. People move around a lot within the industry. So it's the impression you put out of yourself is really important, especially in a fellowship, but even when you're on like APPEs, I think for a lot of you. So I remember like my last APPE, I was like essentially like my preceptor, like he was co-fellows with one of my like managers at where I work now. So it's a very small world. You're definitely going to come across these people again. And like I kind of just said, like when you go to apply for that position after your fellowship, like that's going to come in really handy. And even within your company, like I know at Beijing, like there's people that work here that have like 20, 30, you know, so much experience coming from BMS, J&J, like all these different companies. And like I said, people move around a lot. So you definitely want to make a good impression. I guess something I wish I knew sooner in my fellowship is take on various opportunities. People know you're a fellow and they know you're there to learn. And you're very purposefully included in a lot of like different meetings, different like projects, so that way you get that exposure. So I think it's really important to take on those opportunities. Obviously, you're not going to know everything, so give it your best. And if you don't know anything, you can ask. Like no one at your fellowship will expect you to come in knowing anything for that matter. They know they have to like kind of teach you. So I definitely think those two things, networking and like just be open-minded and take on a lot of different opportunities. I think that's really important in a fellowship.
And I think for me, I learned a couple of things, but I'm not gonna get y'all in the whirlwind. But I would say to relate to networking, I feel like there's this misconception of what networking actually is. Because I truly believe that a lot of people are still married to this concept of selling themselves every time they meet someone. And that's not necessarily what networking is, right? Yes, you do want to effectively and impactfully like tell the story of yourself, but networking is the business term that people use in your ability to manage and keep up to date with relationships. Your ability to upkeep relationships in the business realm is what people call networking, right? So if you reframe what networking is in your mind, when my preceptor and my team says, hey, I put a calendar hold for our ice cream social, meet me in the kitchen on the 3rd floor, it doesn't seem, you don't have to have an elevator pitch for that, right? It changes the way that you view what networking actually is. It's like, wait, I'm spending time with these people. Yes, you're supposed to spend time with your team and your preceptor. You're supposed to get to know them, not just what they do. Like, please tell me you're not going to ask your preceptor about their deliverables every day, right? And when you meet other people at the team, it's like you're sitting next to people and they know other people. So they're sitting next to another team. It's like, hey, how are you? It's your ability to actually effectively care about somebody else. So they call that networking. Just, it's not networking just because you know of them, right? It's networking because you have a developing progressive relationship with them in the business realm. More so like, hey, let's get lunch. I want to know how you're doing. It's been a while since I've seen you. What's going on? Are you doing okay? These are the types of things that helps build an effective and significant network, right? Because a lot of people know a lot of people, but aren't doing anything with the people that they know, right? At key points in time, like, for example, I want everybody to take self-inventory of themselves really quickly. And I want y'all to think about all of the people that you met that are postgraduate, right? And how many of them have you actually reached out to for help during this application season? That exposes the strength of your network and how you value how you've maintained those relationships, right? So that is one thing I wish I knew sooner, because I wouldn't have came in so like CV on my suit, right? Like I'm ready to tell you about everything that I've ever done and everything that I'm going to do. They don't care. They just want to eat ice cream with you. They want to get to know the real you, right? So that's important. The next thing, your projected success, the opportunities that are at your feet are based on your ability to effectively communicate a vision, mission, values, or yourself. Effective communication has been everything, right? Effective communication in maintaining relationships, yes, but in your daily work, your ability to effectively communicate your deliverables, what you're doing, project managing, working across teams and working with people is what is going to be like a key denominator amongst all your successes within pharmaceutical industry. You can't be in this space without talking to people. So with that being said, your ability to understand that the only message that counts is the one that's received is something that you can hold on to in the midst of your success. And those are the only two I'm going to leave y'all with.
Just to kind of piggyback on the whole networking thing, especially on what Jordan said, you really want it to be organic. Just try not to force it. I know sometimes, like when I started like P3 trying to talk to people, I used to say, oh man, when will I reach out to these guys again? It doesn't have to be every 3 months, every 6 months. You just try and create that relationship that's organic, where you can just kind of reach out, and try and find something that you guys relate with, and that can be something that holds you guys together. And one thing that I know helps me is like sports, like soccer. Like I can just like, oh, did you watch this game this weekend type of thing. That kind of helps you keep that relationship and keeps it going and just keep it growing. And then, things can keep growing. So you don't want to force it. Just make sure it's organic for it to be a strong network or a strong relationship.
And I know we have about 100 students and like listening, and for you guys, just to paint the clear picture of why it's so important, why we keep saying networking, why that's important. The majority of roles, our open roles, are filled through internal references, through I know a friend, I know a student who needs an entry-level job, I know a seasoned veteran who can be that director or senior manager. The majority of roles are filled that way, and then they open it up to the public. So having that strong network that you keep hearing from us time and time again, that's the reason for it.
I will say, I have about 6 people on my team 5 of them are in their current roles because of referrals by people they know.
I can also echo that on my team as well. I think Jordan brought up a really good point. Networking isn't just like adding someone on LinkedIn. That means you might know of them and maybe even not know of them, but it's really about keeping up with those connections. And a lot of times that's, like you said, it's just going out and like meeting people. And especially when you're a fellow, I would say like take those opportunities to just talk about life. And I think that's really important, because then you're gonna want to wake up and go to work, log on to work if it's remote, whatever it may be. And I think that's really important to like make it organic. He also said a really good point. A lot of you guys know a lot of people that are current fellows, have done a fellowship. Reach out to those people because they can help you. They can review your CVs. They can do mock interviews with you, like whatever it may be. That is that preparation going into fellowship interviews, the whole process is so important, because I know we talked about like everyone, it's no secret, like fellowships are really competitive no matter where you apply. And I think going into it prepared will really set you up for success.
You guys have just shared some gems. Let me just say, I know everyone's probably taking it all in. Just a quick tidbit, the Pharma Collective, we've kind of adopted something from our own mentors. We don't even use the term networking anymore. We actually say creating meaningful relationships. So that's just a little tidbit on what you can take back and just in terms of frameworking what networking really is all about. But for our last question 4, we've talked about opportunities within pharmaceutical industry, but what opportunities outside of pharmacy school have kind of helped strengthen you guys as an applicant for your opportunities today? And where can students, find these opportunities today? Yeah, some insight would be great on this.
I would say work experience is really big. It does not need to be an industry. I think that's a misconception that when you're applying, you need to have an internship or like something super relevant to what you're applying for. That's not necessary because the majority of people applying won't have that. And I think these fellowship directors, people applying, they know that. They don't expect you to come in having, being an expert in this field that you're applying to. It's all about those skills that can transfer over to the role that you're applying for. And I think that's really important. So definitely work experience. It can be hospital, retail, whatever it may be. And also from your appies, that's direct work. That's literally like a 5-6 week, whatever your appy schedule is like. That's kind of like an interview in itself. And you should definitely take it as that. I think those impressions are really important.
I know there was a couple different things I did that strengthened my application. I was one of those students who knew early on that I wanted to do something in the industry. I think it was the first therapeutic class. Like, okay, I want to do something a little different. And so from the start, I think I was looking from P1 year, signed up for that dual degree MBA and started looking into opportunities to work at Amazon, looking at the FDA, looking at all these different various opportunities. So one thing that I think can definitely help is more admin work, so office work. I think just having those experiences, which is going to differentiate you from all the other candidates who typically may just have like a farm tech job and intern role. I think learning some of that corporate lingo early on so that you go in prepared and ready to kind of acclimate to the situation would be very helpful. I did some research. I let a professor know very early on, I think P2 year, that I was interested in doing research with him. If anything came up, he remembered, he came back to me, and I was able to get published before graduation, which never happens that quick. But just kind of, you have to be outspoken and let them know you're interested in these opportunities for them to remember and come back to you. So yeah, those are two things. And where can you find these opportunities? You kind of have to create them. So I think one of the members of the collective at the beginning of the call was just saying how in the South, they don't have all these different opportunities. I myself had to create my own appy at Bayer. I created a 10-week one. I reached out to former graduates who put me in touch with a preceptor. Then I had to talk with the school and I had to get them to do the contract. And you just have to create this because pharmacy schools are not really going to push this initiative. They're going to push the clinical route. So it's really on you to create your own opportunities, kind of like what we're seeing here today with the collective. It's great work. So you kind of have to be an advocate for yourself. And so I just wanted to say one more thing. As we're answering these questions, please, I know we have a couple minutes left. Students, please put questions in so that we can answer speedingly at the very end while we answer this last question.
I can go next. So what opportunities I had outside of pharmacy school? To be honest, I didn't really have any outside of pharmacy school. Well, I guess besides working at a hospital. Most of my things were within pharmacy school. So for example, like what Sharma said, working at a hospital is very important because you can learn skills like how do you deal with conflict. There's always going to be conflict, at a hospital. So those are things that when they're going through the interview, they want to know how do you deal with conflict? How do you work on a team? You can kind of get that from, just working in a hospital. For me, in the school, what I did was I took leadership positions such as AMCP. I was able to kind of host like a conference virtually. And, I worked with a team, and I got those skills from there, working with a team, delegating tasks to people. And also just like the home, I also created an opportunity for myself and also, I guess, other students at my school. I got a rotation at BGB, which was very, very impactful to my journey because they're a medical communication agency. And so they work on tactical things for marketing. And so I was able to use that experience and kind of spin that around into getting this marketing position. So it's just more of like, what do you want to do? And, if you have any idea, just go out there and get it. But usually what I did was, just look in school, talk to a lot of people, and then those guys will advise you on steps you can take. And then you can also just look for new opportunities outside of school.
I'm gonna piggyback off Dr. Arano's point. Just by saying that the opportunities that you experience, yes, they're valuable wherever you can find them. But I challenge you to take a step beyond just experiencing what you've experienced, just beyond getting the title, just beyond being able to deliver something that you believe is of value. But what truly differentiates you in the candidacy process is showing that you understand the impact of what you're doing, right? And you can effectively communicate that, right? To note that as a pharmacist or as a pharmacy student, you're constantly on the grassroots of medication education efforts and comprehensively meeting the needs of your community. These are terms and phrases that show that you understand the value of what you're doing, right? And it goes to you're inadvertently communicating with the company that, hey, I know how to speak to the why of what we do. And I think that is what brings true value as a candidate, to say, hey, not only I'm proficient in Microsoft Excel, or I can type 60 words per minute, but more so, I understand the why. So as the company continues to change, because newsflash, if those who are unaware, right, pharmaceutical industry continues to change and continues to evolve, right? So at some point in time, you're looking for managers, right? But at another point in time, you're looking for innovators. You need people that understand the value of what they do, why we do it, and how can you help push our mission forward? Because at that point in time, positions dissolve within pharmaceutical industry because that need has been evaluated that need is no longer needed, right? That position is no longer needed because we're evolving past that. So can you understand why we're doing this, and can you move with us, right? So that's the kind of filtering process that the interview process kind of does.
Thank y'all so much. We really appreciate these responses. Now I know we always try to stay respectful of the time. We may go over just a little bit, so if you have to drop, please feel free to drop off. These meetings are recorded, and we will be posting this on our social media accounts as well as our YouTube for those who might have to miss. But now it's y'all's turn, kind of like the slide says. So I did see that we started putting our questions in the chat. I'll go ahead and, just for time purposes, kind of start reading some of these. Our first question came from Jasmine, I believe. So thank you all. Thank you, Jasmine, for dropping your question as well. But her question is, what advice do you have for fourth-year student whose API schedule is already set without any industry rotations? My school also in the South, I know your struggle, is pretty strict and isn't as open on non-traditional rotation options. So,
I'll hop in on that one because
I was just going to
actually,
say, Jordan basically just said, yeah, you just answered this very well. Go ahead, please.
alrighty, so I'm somebody who had only one rotation that was in person. I had no API rotations. I had no industry rotations. I had no industry rotations or internships. And when I tried to get one and try to get it changed, because I found somebody at Eli Lilly that was willing to be my preceptor, I was denied by my Office of Experiential Training, right? So with that being said, it's finding what they call transferable skills. Understanding the why of what you do is very important. Don't panic. It's okay. There are a lot of people that apply without that experience, but what you can get is project management experience. Lead something, create something, evaluate the need within a community, work with SNAFA, work with SSHP, work with all of these different organizations that are at your disposal to meet some need that you have evaluated is prominent within your community, right? Know the analytics, get your data, get your results, and be able to effectively communicate that when called upon, right? Do that as many times as you can within your 4th year, and I promise you will have nothing to worry about.
I was just going to say what Jordan said earlier as well about how you communicate your experience. So you can have no industry APIs, but you can have an experience at a hospital and you can speak to it in a way that those transferable skills come out and shine and shows you know, whatever opportunity you have moving forward, you're going to use that same effort. So just being able to speak to the experiences you do have in a very creative way that shows those transferable skills.
I definitely will echo that. My industry rotation was my last block, so it was not, I didn't have it prior to applying. But like I said, it's about transferable skills. So like I was really interested in applying to something that was more oncology focused. So I did have a rotation at like a cancer center. So that's something I talked about. No matter where, even if you're at a hospital, like most hospitals have investigational drug services. So just finding those like unique opportunities that can transfer over, I think is really important. You don't necessarily need to have direct industry experience.
Thank you, guys. I am going to just go ahead and quickly share something. We'll come right back to the questions. But I do want to say that there is something big really happening. Pills and Pharma Collective are officially collaborating. We're having a PXP mixer September 8th, 2022. We would like for all of you guys to come join us. We'll have more information coming out via Pills and Pharma Collective social media and LinkedIn. So please stay tuned to that. And while I'm speaking about big things, I do want to give Nahum a chance to share his little big things before we go back to our questions.
Yeah, so thank you for that. So I am in the process of creating an ebook, which is going to be a repository of information for students like yourselves that are interested in getting into pharmacy. There are resources all over the place, but there's never in one place where you can get all the information to prepare your resume, cover letters, how to network with different individuals, where to look for jobs, what jobs you should be posting for. I feel like pharmacy schools to some degree have failed us in not educating us on these different steps. And every PharmD in industry I know gets 100 students reaching out to them on LinkedIn, and they try to help all they can, but we only have so much time. So the goal is to create this ebook to provide the students. The way I'm looking to do it is to have universities have me speak. I'll speak at the university. If I speak at the university, I'll be providing a free copy to all the students. So the way to get it is just to urge a university to reach out to me, and I'm trying to provide it to students for free. I don't want to charge anyone to better themselves, but I'm trying to create this so that you guys can have one place. And yeah, so I'm going to include all the opportunities, everything I've spoken to students about in one place. So if you're interested, you can I'll put my email below. You can either reach out to me or have your school reach out to me, and we can hopefully, you'll see me on your campus soon. Thank you.
Thank you, Nahum.
Awesome.
Yeah, go ahead.
No, I was also just going to urge the other speakers to also put in any contact information, whether that's their LinkedIn or their emails, if they do want to offer any of their support or services for students to reach out to. Sorry, Milka, you can go ahead.
No, you're good. I wanted to give a chance for us to get back to our questions. Thank you to our panelists and everyone who have stuck around so far just for the show. But yeah, let's go back and see what other questions we can ask. First of all, the panelists, are you guys good to stay on for a little bit longer? Okay, we do try to stay.
Yeah, absolutely.
Thank you guys. Thank you. Pouring into us. We love it. Thank you.
That's perfect. We always do try to stay respectful of the time of everyone's time,
Yeah.
so we really do appreciate it. Now that's great news. And so this next question is actually for you. Funny enough, so Esther wants to know: can you still apply for a leadership program without an MBA?
Yep. Yes. So you can, and I've been made aware of some programs that are not requiring you to have your MBA. Typically, these leadership development programs are on the commercial side, and they do require the MBA. But there are some in research. There are some in regulatory affairs that don't require your MBA because it's not necessary for that skill set. So I'm going to be doing a little bit more research and putting that into the information, into the ebook that I'll be creating. But also, as you look for some of these, just taking note of what are commercial roles and looking for roles that are not necessarily commercial. So it's not the clearest answer, but that's because I haven't seen some of these yet, but I've been made aware recently. So the short answer is few of them, you don't need your MBA.
I can just kind of
Sorry.
no, go ahead.
Sorry, I was going to piggyback on that because I was also interested in that leadership development program last year. And I reached out to Noel, and he really helped me out last year. But I do know that like there was one program, GE Healthcare. You can they mostly focus on sales, so you can also apply to that, and you don't need an MBA because I do know someone who's in that program. And that was one of the programs I remembered, and I think Amgen has something like that. But yeah, so there's definitely programs out there that you don't need an MBA for.
I was just going to piggyback and say Genetech also has a development one that you don't need an MBA for, and Lilly also has one that's more on the research side as well.
Perfect. Thank y'all so much. And thank you for the responses. And Nahum, thank you for answering some of these questions. To our panelists, please feel free to answer some of the questions in the chat as well. We probably won't have a chance to take everyone's questions, but this is a challenge for everyone, kind of like we were stating earlier, to use your network and reach out to some of our panelists and try to get your individual questions answered. I'll go into the next question from Cassie. And this is I think this is a pretty good question because, we still are in the midst of COVID and things are kind of going back to being fully virtual, as opposed to kind of being coming from a hybrid world and from there being completely virtual. So how do you think the field of pharmaceutical industry will change within the 5 to 10 years?
Okay, I'll see if I can tackle this one from a conceptual standpoint, right? So the workplace environment is something that I feel like pharmaceutical industry has been forced to change, right? And they're still trying to figure out what works best for the company as far as how they work with each other, how they plan to evolve, and what is this new normal that we're kind of settling in, right? There are certain positions that have been transitioned to remote by design, which means they're permanently remote. There have been budget cuts made due to the restrictions within COVID, but now those budgets are staying stricter due to, I'd say, like an analysis of the utility of having people travel across the country or across the world for certain conferences, right? So like there's a self-inventory that pharmaceutical companies are taking of themselves of how to be more efficient and to be more impactful. And then as things like the IRA, right, become landmark changes within the pharmaceutical industry, that also affects our pharmaceutical companies' abilities to create new and innovative products to meet something out in the field, right, for our patients, right? So with that, as those things continue to evolve and change, the current norm and environment and atmosphere of what we try to do, right, which is to bridge the gap of an unmet need for patients, I feel like we will continue to evolve in those ways, try to find more ways to be more efficient. Maybe more roles are needed. Maybe there's a different type of person that is needed, whether that's their background, what they can contribute to the field. And I can say that over the past 20 to 30 years, based on the people I've spoken to, right? The amount of PharmDs that have now kind of like overwhelmed the pharmaceutical industry as far as like their value that they've been able to bring to the table has been very significant and impactful. So it'll continue to change and evolve in that respect.
I think in terms of like the remote versus in-person aspect, I think that really, in terms of fellowship at least, that really depends on what your position is. Like my position is completely remote, but there's not too much reason for me, like I would be doing the same thing in an office that I could be doing at home. So I think a lot of companies are not realizing that cutting down on that commute time where you don't have to like go and serve, saving money on like things like gas, relocation. So there's a lot of flexibility there. It obviously depends on your company, your position, your role specifically. But I think a lot of companies now are switching to this either remote or like at least like a hybrid model where you don't have to go in 5 days a week, 9 to 5 sort of a thing.
I agree with that. I definitely am seeing a lot of that in my company. I'm working a flex schedule where it's 2 days in the office, sometimes less, and then the rest from home. So no complaints here. It's a beautiful thing. I think another trend we're going to tend to see over time is consolidation. I think as the economy tightens up, a lot of the smaller companies are going to see some mergers and acquisitions. And I think that's going to affect it depends on which company you're at, but it's going to affect some things. And we're going to see larger and larger corporations and fewer players. So just small thing to be noted.
One big thing from my side would be just kind of like the breakthrough in oncology treatments. I think, a lot of the big companies are really focusing on that. So, hopefully during our lifetime, we can see some type of medicine that, makes oncology more like a manageable disease than a death sentence, or cancer as a manageable disease rather than death sentence. So that's something I do see will be happening. Hopefully it'll happen in our lifetime though.
Well, we definitely appreciate your answers. And once again, we are reaching the end of our session. Once again, we do want to thank the panelists for coming out and taking time out of their schedules to talk to us, not just us, but also the rest of the students who came out tonight to listen to y'all. We definitely want to give appreciation to the students who came out to our very first episode for season 2. Mark your calendars, like Milka and the rest of them said. We have the PXP mixer coming up. We got a lot more events coming in season 2. And, just stay tuned. And we appreciate y'all for coming out again tonight.
Bye,
Thank you.
everyone.
Have a good one.
Thank y'all for having us.